Hi everybody, if you're considering chin liposuction, I want to give you 3 reasons to be a little bit wary about chin liposuction as a standalone procedure. If you're interested in this, stay tuned. Hi, I'm Dr. Jonathan Zelkin, a board-certified plastic surgeon in Newport Beach, California. My practice really does focus on sculpture of the face, facial plasty, breast and body surgery as well. Today I want to talk about chin liposuction, which is a very popular procedure. It's definitely gaining popularity. It's going to be one of the top 5 procedures, I'm sure, of 2023 and beyond. And there are important limitations of chin liposuction as a standalone procedure that I want to discuss today. And I can't remember the last time I did chin liposuction as a standalone procedure. I think doing it without certain adjuncts has important limitations. So number 1, chin liposuction as we commonly know it is performed often as an outpatient surgery, oftentimes awake, through a single incision underneath the chin. And a surgeon can take out anywhere from 10 to 100 or even more cc's of fat to try and create better jawline definition. But that as a standalone procedure has a lot of potential downfalls. If you only do submental liposuction through a single approach, my opinion is that you can flatten the jawline and create a relative deficit in the middle, whereas you're sort of neglecting the fat along the jawline border further back. And that gives you sort of a wide double chin type of thing where from a side profile it looks okay, but when you're looking straight on, something seems to be missing. Also, you can get contour deformities if you don't really cross-hatch your liposuction pathways. So I think that is an important limitation. A lot of surgeons are getting more savvy to this and using anywhere from 3 to even 5 approaches towards submental liposuction. And the more approaches you take through the more planes, the better contour you can get. And you can start to really sculpt the jawline. But then even in these cases, a lot of surgeons will neglect either the perioral mound or the jowl. And what makes a jawline go away is either fat, sagging skin, number 1. Number 2, fat that sort of clouds the bottom border of the front of your jawline. And then also fat that clouds the bottom border of the back of your jawline. So a lot of times I tell my patients, if you're lying down, I want to be able to do a ski jump off of your jawline and onto your neck. So we talked about really focusing on submental liposuction working its way back into what I call a subgonial fat pad, but also there's something important called the jowl, and a lot of patients have premature jowling, and that is a fat depot in the superficial fat layer that kind of falls down right here and also punctuates your jawline. If you neglect that during surgery, in my opinion, you're only addressing one aspect of jawline definition, and you are neglecting something that can also really enhance that result by resecting very strategically fat in the jowl area. Of course, you don't want to be too aggressive about this, and targeted micro liposculpture is the solution. So if this sounds really kind of like hazy to you, or your surgeon doesn't understand it, or it sounds like it's maybe too sophisticated, you really want to seek out a plastic surgeon who understands the nuances of where you can be aggressive and where you need to really pump the brakes a little bit. This is an area you need to pump the brakes, but at the same time, it's really important to enhancing good jawline definition from the earlobe to the tip of your chin. Finally, the third thing is a lot of surgeons neglect the importance of the skin envelope itself. If you're going to be aggressive on a submental region and a patient's either aging or their skin elasticity is not up for the challenge of snapping back, you can either expose the platysmal muscle in your neck, or you can get redundant skin that just doesn't snap back, and that creates a visible band in the front of your neck. Even in patients who have seemingly good skin quality, this can happen with submental liposuction alone, especially if you take out more than 20 to 30 cc's of fat. In these cases, what I do in my practice is I combine submental liposuction with a technology called FaceTight, which is radio frequency skin tightening. And by doing that, I'm creating a degree of trauma to the fat layer, which is very, very important to understand. Will lead to collagenesis, or basically creation of scar tissue in that fat plane, and that turns that loosey-goosey skin into something more robust. Patients who are in their 40s and 50s, or they already have skin laxity and submental fat, you're starting to get into facelift territory now. even the minimally invasive options will fail. It's not going to be enough. Face site won't be enough. And this is a mistake that I made early in my face site practice, where I was a little bit more open in terms of who I was allowing, who I would consider a good candidate for that procedure. As I became more sophisticated, more experienced with the technology, I learned when to say no. So there is going to be a spectrum. I think in the youngest of patients who have, localized fat excess in the double chin area, submental liposuction may be enough. But for most patients, you've got to bridge that gap from their, teens to their 30s, and you've got to do something to the skin layer, and that's where face site comes in. Finally, if you're in your 30s and 40s and your skin's already showing signs of inelasticity, you've got to consider facelift options or more traditional excisional approaches. I hope this video helps. I hope I didn't confuse you more. But yes, keep in mind that submental liposuction, as great as it sounds, it can be done awake and it's safe, does have important limitations that your surgeon must consider. If you have any questions about this procedure or you want to learn more, don't hesitate to reach out. Be sure to subscribe, turn your notifications on, and leave any comments and questions below. Thank you so much.